Hello, my name is Dr. Justin McCormick. For the last 10 years, I've been specializing in the diagnosis and treatment of chronic pain, of chronic fatigue, and different disc diseases that people have been suffering with. So basically things like fibromyalgia, bulging discs, slip disc, degenerative discs, herniations. These are the things that we focus on in our office, things that have given people chronic pain for many years. We focus and we specialize in a new treatment in this Seattle area called brain-based therapy. In conjunction with that, we use highly specialized technology called spinal decompression and laser therapy. Although different people vary in terms of their severity and the amount of time that they've had these problems, the average success rate that we have in treating conditions that I've spoken about is between 80 to 90%. And of course that depends on whether people qualify for treatment or not. So first I'd like to talk about what is fibromyalgia. A lot of people think of fibromyalgia as it's just a muscle problem. The reality is, through the research that we've done here in our clinic, it's more of a neurological problem, and I'll talk about that in just a moment. But first, why do most treatment fail for fibromyalgia and chronic pain? Basically, the #1 solution that people have is drugs and medication. And while that may be okay for acute pain, things that people just begin to suffer with, it can hide some of those problems, enable that person to heal faster, and get them out of that problem. The problem is that people are not using drugs and medication for acute problems. They're using it for things they've had for 1 year, 5 years, maybe even 10 years or more many times. And all that is doing is covering their pain, covering their symptoms, and allowing that underlying cause to manifest. Many times actually getting worse over time. More powerful drugs that they're on, more drugs, all of a sudden they're on this cocktail of different medications, destroying their life. What do? We find the cause. What's the underlying cause? What's the reason this person's in this chronic pain? Correct that problem and enable them to get their life back. And that's exactly what most people say once they're healed. I got my life back. So let's talk about what is fibromyalgia. Now, I said it was a neurological problem, not so much a muscle problem. Well, here's how that works. The brainstem, the midbrain in this area where my hand is right now, is the primary thing that's affected with chronic pain sufferers. There's 3 parts to the midbrain. It's called the mesencephalon, about here. Then it goes down to the medulla, and then down into the pons. Those 3 areas coordinate all the functions of the body. So what happens is this area regulates the upper part of the brainstem, which is sending messages into the body to enable it to do its functions that it needs to do for survival. Well, what happens is through some type of stress, whether chemical, emotional, physical, this person's midbrain stops functioning normally again. Okay, many times it's stress. Stress causes that overloading of that area. It shuts down, just stops working. So now what happens is the upper brainstem is constantly firing into the body, giving it abnormal stimulus. So for example, let's talk about pain, okay? That midbrainstem that I talked about should go up to the upper brainstem and regulate transmission into the body of whether there's pain or not pain. But what happens is when that midbrain is not working, that is constantly firing into the body, and these cells this substance called nociceptors begins being released. What that does is creates pain all over the body. It could be in the shoulders one day, the knees the next, across the back. All these things can happen at different points in different days because your body is overstimulated right now with pain fibers. Another thing that can happen is many chronic pain sufferers are very light sensitive. Basically, when that upper brainstem is overfiring, the pupils can't dilate to constrict the light out. So they're constantly being bombarded with light sensitivity. They may have heart palpitations or heart fluttering because, again, that upper brainstem is going down into the heart, overstimulating it, so it's going like this all the time. Another very common thing I see with chronic pain sufferers is they don't sleep. Okay, they're up all night. Maybe they'll sleep for an hour, then they're up. Sleep for an hour and a half, and then they're up again. And the reason for that is that upper brainstem should be regulating your sleep patterns. Well, if it's not working because it's being oversensitized, 3 a.m. in the morning, that person's going through these sleep patterns again where they're waking up more than they're sleeping. So what we do is find out where that problem is and correct that problem. We use highly specialized technology, like I said here. The first thing that we do is we make sure that that brain is using the fuel and activation like it should. Well, how do you get fuel? In the form of oxygen and glucose. So one thing is we want to make sure that our patients are on a good diet, that they're getting the proper glucose into the brain. Also oxygen. We are not getting the oxygen that we need. So we use oxygen concentrators that drive 90% or more of pure oxygen into that person's body, enabling the brain to function properly. We use laser therapies, as I said. Laser therapy is shot into the body and it stimulates your cells to heal up to 30% faster than without that technology. We use what's called UBEs, or upper body ergometers, and what that is the patient is doing exercises while they're getting that oxygen. It stimulates the activation of the brain to start healing and restoring the normal function and integrity of that person's body. We do a lot with supplementation, primarily things like L-tryptophan, which stimulates serotonin release in the brain that gets that upper brainstem to start functioning normally again. We use what's called spinal decompression, or DRX-9000. That's the technology behind me here. When the patient has a disc problem from a that's compressing on a nerve, that disc will open up through decompression, release the pressure on the nerve, enable them to heal faster. And of course, on top of that, we do different nerve activation things. We use what's called an activator. We'll go through the person's body. Where is that nerve being pinched and not allowing your neurology to function properly, thereby giving you this chronic pain? We use what's called an activator. Stimulating different points, opening up the nerve, enables you to heal faster. So this, and on top of many other things, are what we use to get people better here. And like I said, we have a very high success rate with this new technology that we use. Before we can tell you if you qualify, we need to know some information about you. After you enter your information on this web page, you're going to get a confirmation page. That's going to enable you to determine, before you even come in here, if you qualify for care or not. At that point, if you do, make that appointment. Call our office. It's a free consultation. Our staff will set you up. They'll let you come in here for that consultation, and we'll go through 4 different checklists to find out if you qualify. I know you guys have insurance questions. You probably have financial questions. Very important. I understand that. Let's find out first if you qualify. Let's not waste any time if you don't qualify. It takes our staff a lot of time to go through that. First, let's find out if you can get help. If you do, we'll go through all that financial information, make sure this is a good, comfortable, affordable treatment plan for you guys to get your life back and be functioning better at your 100% again. Okay, thanks, and I look forward to hearing you as soon as possible. Remember to fill out that information below, and that will take you to that confirmation page. Thanks very much.